welcome to the Rotary
Thank you.
Club, a 72nd club founded in the world. Our invocation today is going to be led by Mandy Clayton, Director of Development at Lamar Institute of Technology, and pledges will be led by Debbie Maxwell, registered nurse, Krista St. Elizabeth Hospital. So Mandy.
Sorry, I had to unmute. If everybody will join me in prayer. Thank you, Father, for the gift of Rotary and for each other. Please bless us all with the gift of a servant's heart. May we ever be mindful of those in need. Help us to provide to the hungry, to heal the wounds of hatred with our love, comfort those in sorrow, and bring peace to those living in areas of unrest. Through our service, we thank you for all your gifts and our gifts. We ask for a special blessing for those who aren't able to be with us today, and a special blessing over our speaker. In your name, amen.
Okay, please join me in the pledge to the United States flag. I pledge allegiance to the flag of America,
of the United States of America, and to the republic which it stands, one nation under God, indivisible, with liberty and justice for all.
And then for the Texas flag, honor
the Texas flag. I pledge allegiance to the Texas, one state under God, one and indivisible.
Thank you.
Thank you, Mandy and Debbie. Now for a little club business, we're going to start with Gary Moncla, who's going to talk about the Show Your Colors flag project.
Thank you, Cindy. This Friday, of course, guys, is September the 11th. This could be 9/11 Patriots Day. We do need a few more volunteers for the flags. If you can, just get with me or Pat or Jackie and let us know if you can make it. We're going to meet at the Boy Scout office over on Cardinal Drive in Finette, as usual, between 4:30 and 5 a.m. Usually by 5, everybody's gone. So if you're coming to help volunteer, try to get there a little before so they don't have to wait on you. And also, if you're planning on picking up your flags on tomorrow evening, on Thursday evening, we're still doing that because of the COVID situation and social distancing. So between 5 and 6 o'clock tomorrow evening, if you'd like to come pick up the flags for your group so you don't have to get up a little extra early on Friday morning. It's been working out for a lot of groups. So Pat and I will be there to help you get loaded. Just let us know so we'll know you're coming, because if it's 5:30 and nobody's coming that said they were coming, we might leave. So don't just show up. Try to give us a call so we'll know to expect you to be there. And that's it.
Thank you, Gary.
Thank you.
And now John Lee is going to talk about an upcoming service project that we have.
Well, it seems like it's been almost forever since we were able to do a service project, but we have another one that we want to do on September the 26th with the Sleep in Heavenly Peace. We've done this before, where we construct beds for kids that do not have one. And it's the perfect project for this time, because for the most part, everyone wears a mask. Everyone wears gloves because everybody's working with wood. So you're either sanding or cutting or stacking, but you are, it is a very much of an assembly line operation. You can talk to anybody that did it before. Last time we as a Rotary group set a record, and I believe it was 49 beds or 50 beds that we made in the 3.5-hour period. So it will be on September 26th from 8:30 to noon. And anyone that would like to volunteer, I'm going to send the information to Jackie so that she can get a sign-up sheet going, and I'm sure that'll be up within a couple of days. So we've got some time here, but Saturday, September the 26th, we could use the help so that we can make some beds and get these beds out to kids that are currently either crowded together or sleeping on the floor. So thanks a lot, and hope to see you there.
Thank you, John. Just want to briefly mention our fun and fellowship socials where we're going to meet at restaurants, small groups of those who are comfortable doing that the week of the 21st of September. So we should have the information together by early next week of what locations and times are available. And you can sign up for that through a sign up genius or however Jackie puts it together when she emails it out next week. And now I want to thank those of you who have done so much work in our community through the Salvation Army this past 2 weeks. I've seen numerous posts on Facebook of people in our club that are there and at the food bank, and it's just such a blessing to be part of a club where people give so much of themselves to the community. So they can still use volunteers. They're still going to Louisiana since there's no power over there taking food. So continue to keep them in your thoughts. And if you have some time and can work out with them, then Jackie has the link for you to sign up that she sent out through the Rotarygram. And the contributions of those that we've collected, we're trying to get those over there pretty soon. We were talking prior to the meeting, if you missed it, that we got a very large donation. So Pat's trailer is already full, and then we'll be adding in the different things that we have collected at the Rotary office, and that's getting pretty stacked up too. So thank you for all you've done to help out with the disaster relief efforts. Now to introduce our speaker, Deborah Drago, Executive Director of the Southeast Texas Nonprofit Development Center. Thank you, Deborah.
Thank you, Madam President. It's my pleasure to introduce our speaker, Robin McCutcheon. Robin is the Executive Director of Samaritan Counseling Center of Southeast Texas, a nonprofit counseling organization that uses the concept of mind, body, and spirit to promote the healing and growth of people and the reconciliation of couples, families, and organizations. Samaritan has served Southeast Texas with mental and behavioral health services since 1984 by placing value on the sacred dignity of each individual, couple, and family. The Samaritan staff finds ways to bring hope and healing in the community. Robin is a Lamar University and McNeese State University graduate. Her career has spanned public school teaching to regional, state, and national educational consulting. She has worked with district and campus program evaluation and effectiveness, higher education teaching, and field experience coordination, alongside serving numerous community organizations. Born and raised in the Groves, Robin and her husband, Darren, have loved raising Laura, Hookem, and Jacob, Gig'em, around friends, family, and their church community. Robin finds her greatest joy in serving others and finding ways to empower those around her to find their purpose. Please welcome my friend and colleague, Robin McCutcheon.
Thanks. I was glad Deborah added in there. As I joined early just to try to meet a few people, I realized that me being a Hookem mom and a Gig'em mom really fit in well with the group. So I can go both ways. I also realized that it was okay that I have not had a haircut lately. My tech skills are so-so. I might support the group with that. But I'm very concerned that I have to sit at the same table every time I actually do come to lunch because I am a roamer. So I'll have to wait and see how that goes. So I do see some familiar faces in the group, so I'm glad to get some time to visit with you. And for those who I have not met, it's great to be here and be with you for today. When COVID hit in March, I began to do a lot of research around how does an organization like Samaritan support the community during a pandemic, because we've been so accustomed to supporting the community after a hurricane, or in the fall, we ran a hotline after the TPC explosion. And so this was going to be a different type of thing that we were going to have to support our community through. And so as I began to research and look through things, something that really came to mind was the fact that we were going to have to find ways to support the community in ways that we had never done before. And I think that's very true of the work that all of us are doing in the community. And so one thing that is really important to realize, and Jackie, I'll probably be ready here in a second to share my screen. So let me.
You should have access. Go ahead.
Okay. Here we go. There we go. There we go. Is some research that was done by the Meadows Mental Health Policy Institute. And this was back right after COVID hit in April or May. And it says that we must prepare as communities, as leaders, that there's going to be a new disease called the disease of despair. And it was very true, and it has become very evident that over the past several months, that is where we are as a community. And this was written after the pandemic. This wasn't written after civil and racial unrest. It surely wasn't written last week after Laura hit Southeast Texas. This was something and a thought that was conveyed in March. Let's now think of where we are. We've accumulated all of these other types of traumatic events in our lives and in our community's life. And so I've been using this visual of the Grand Canyon lately because I am deathly afraid of heights. I can't even go over like the 610 loop without having a panic attack. And so I began to, every night I lay down, have this vision of the Grand Canyon, and that I was at the top of the Grand Canyon and I was being forced to get to the other side. And I couldn't use a tightrope, and I knew I couldn't zip line. How was I going to get across? And this overwhelming experience to get across continued to enter into my dreams every night. And I thought, if I was having those as an individual who works for a community of mental health supporters, how was the people in our own community trying to react to what was going on? And so as a community here at Samaritan, we began to look at what were going to be ways that we could support those around us, but also be safe in a mentally healthy way. And so within 1 week of COVID hitting, the community in March and the shutdown, we immediately went to a video teletherapy based environment, which is not an easy transition. I learned earlier, I was listening to Mr. Charles, and he actually said, this is a miracle that we are all here together. And that's exactly what we felt like with our community of clients, was that it was a miracle that we were going to be able to continue to provide services. As leaders in Southeast Texas, we have to continue that thinking, that this can be a miracle of supporting our community in ways that we never thought we could support before. Some things that we have found within mental health is that since March of this year, we have had a 10% increase in clients using fee assistance. Samaritan's one of the only local organizations, Spindletop Family Services, Gulf Coast in Port Arthur, that allows clients to come to our facility and use fee assistance to support their mental health services. We've had a 10% increase in fee assistance and a 12% increase in Medicaid clients. We're one of the only facilities that allows to bill for Medicaid. Overall, in our financial use of providing services for clients, 1/3 of our clients have been given resources through a fee assistance program. And so that's not going to change. That's going to continue to rise over time. simply for the fact that there are families who continue to be laid off from their jobs and not finding another job to support their financial situation at home, as well as, because of that financial situation, the increase in anxiety and depression over not finding a job. We're seeing an increase in families that are coming to the center. All of these children have been home since March. Some are just going back to school. And so those types of things are on the increase. An interesting piece of data that I ran at the end of August is the fact that in August of 2019, we had about 2,500 sessions. In August of 2020, we had about 2,500 sessions, and we were off for 2 weeks for COVID, and we were off just 2 weeks for Hurricane Laura. So our population of services are not decreasing, and we were off for almost an entire month with those services. That's going to be at all mental health facilities. That's not just Samaritan. That's going to be at Spindletop and Family Services and all of those organizations that provide any kind of avenue for people in the community to come and have conversations. So we as a community are going to need to continue to refer people to organizations to seek those services. And we have seen, once again, because of the only way to provide services is through a video or telehealth environment. And the same is true at Spindletop, Family Services, and so forth. I love this quote about the fact that we all have a story to tell. We all thought in March, we never knew that this, where we are at this moment, was going to be the story in September of this year. And so this conversation about the fact that the narrative that we thought our story was going to be in March, I thought at this point, I was going to be doing something else at Samaritan. We would be moving in a different direction, that all of my therapists would not be in a tele and video environment. We thought we would have other programs and projects going on, but it's not. In March, that was completely ruptured and turned upside down, just like all of the organizations and businesses that you work with. That 2020 year plan of what we thought we were going to happen did not happen. But every time we have conversations like we're having today, or that like you have in your office on a daily basis, or on the phone with family, every time we have those great conversations, remember that a new story is written. And that's a great joy to have. It's a great joy to know that whatever story we thought was going to happen is changed, but that's okay to have a new story that we may be writing. As leaders in this organization and in the work that you do, you have to find joy in sharing that. And we're going to talk a little more. However, David Kessler is a researcher on grief. And the fact is that we're not going back. What we knew on March the 9th or March 10th or 11th, whatever day you associate with the shutdown and where we are today, it's not going back. Just as you guys, Cindy was mentioning, how do we go back to having our Rotary luncheons where not everybody comes back together, but we still make everybody feel a part of that experience? Because what you did either at your February or your March Rotary meeting is not coming back. And so the sooner that groups and organizations realize that you must change and be okay with the change, and realize that it's a true loss, and that you can grieve that loss, the loss of what it was, because we have to have a newness to wherever we're going. This particular research was done two and a half years ago on different kinds of things that cause trauma. I want you to look at that list and think, how many of those have happened in your personal, professional, and in our community? Well, physical and social distancing happened for all of us without our questioning. Financial hardships, the media, grief, loss, neglect, violence, accidents, natural, all of these things have occurred in our own community. And this research was done 2 years ago. So when we think about all of these things, these are the phone calls that we received just yesterday. Anytime I share with an organization, I always go back to the phone calls that we received the day before. So that way you can have a true picture of what does our community look like right now. A phone call yesterday was from a single mother. She has 3 daughters, 13, 12, and 8, and her 12-year-old had run away for 24 hours. They found her and she returned home. She wants individual counseling for each daughter individually, and she wants family counseling for them as a family. We have a mother who called yesterday who is calling from a foreign country. She had left in February to go take care of her elderly parents. She has not been able to return. Her husband and her 12-year-old son are living here in Southeast Texas without her. So they have been distanced for 6 months, and she doesn't know when she's coming back. So she was calling to get counseling for the husband and the son, and if they could video her in, she would participate in a video therapy session. Just yesterday, 4 CPS cases where we find us parenting training for the parents who have had their children removed, and we provide support for the foster family who's hosting the children in foster care. We know across the board that over the coming months, we will see an increase in children in CPS care. For the past 6 months, our children have not been in school, and in some communities, they're not going back this week either. Our school systems are where a lot of our children are recognized as needing CPS services because teachers and other school personnel can report. We have children who have not been around anyone but their own families. And so there have been lower numbers due to the fact that there haven't been those self-reports by teachers in school settings. But then there's also an increase in numbers because children have been home more. So a decrease in school reports, but an increase overall. So those cases will continue to rise. And then just overall depression and anxiety. So we had a little over 20, this was just a summary, we had a little over 20 phone calls just yesterday. So each week, if each day we have between 15 and 20 phone calls a day, we're seeing between 70 to 100 phone calls for clients needing services. And that's to Samaritan alone. Add up what could come from calls into Spindletop, into Catholic Charities, into family services, and just other mental health facilities across our region and area. And what our counselors are seeing is complex trauma. These are families that have been exposed to more than one traumatic event. Many are still recovering from Hurricane Harvey. We've still got the clients who are recovering from Hurricane Imelda, Tropical Storm Imelda. We are also seeing the clients from the TPC explosion in the fall. Now we've got the COVID clients who are having the anxiety from that. I don't want to go out, I don't want to stay in type experience. And then now that the electricity has begun to come back on and people are able to have their services again, it's now this experience in the past 2 weeks. And so we do have the PTSD clients from those triggers. Some information that one of our counselors has done some research with is catastrophic trauma. And that's the fact that with the COVID pandemic, we don't know when it's going to end. You know, with some traumatic events like hurricanes and tropical storms, we know what that looks like. The water comes in, the wind comes in, the homes are destroyed, we dig out some sheetrock, we haul over some water, we give them some supplies. We kind of have a feel that several months into it, we keep doing those things and we provide those services. But 6 months, a year down the line, we can begin to see the light at the end of the tunnel. And that's just a traumatic event. What some research is saying is that we're in a catastrophic trauma phase of we have no idea what the pandemic is going to be like in 3 months, 6 months, 8 months. In March, we made a 90-day plan because we said, you know what, in 90 days, we're going to be back in the office. We're going to be back to seeing clients face to face. We're going to have a 90-day plan. And on day 90, my staff said, now what? Because we're in this experience of now what? What do we do next? Because we don't know what it's going to look like. And so these are things that people are experiencing through this. People are having difficulties with relationships, and it's for reasons that we're here right now through a Zoom conversation. Isn't it great to sit here? As Mr. Charles was saying earlier, this is just a miracle to just sit here and be able to see one another and have some conversation. But wouldn't it be even better to be able to shake a hand, give a hug, and have that physical interaction with people? Because we're not having those things right now. Of course, the anxiety and depression is on the rise across the region and across the country. Not being able to self-regulate whenever there's outbursts or those anxiety moments. And then the last two, I know that you probably see within your own organizations and families, is that there's just this negative thinking, this hypervigilance of what if and what if and what if moments of can I go to the grocery store? Can I not go to the grocery store? Can I have dinner? My husband and I went and had dinner last night out at a restaurant, and he forgot his mask at the table when we were getting ready to leave. And the eyes he got of the people we crossed as we walked out the door, because there's that vigilance of what if he's the one? And so some things that we have to keep in mind is that for those of us who understand that there is this stimulus and response, right? When he got up without a mask on yesterday, there's going to be a response. But how the people respond to that is a great freedom that we could have. Do we give grace to one another whenever there is a moment of uncertainty, whether it be to the pandemic, whether it be to this hurricane that we're experiencing at this point? Is that middle moment a moment of grace towards those around us? And as leaders, that's something that we can offer in order that the people that work around us can also do the same to the clients. So I wonder if you are. I wonder if you're this unicorn rainbow, or do you see yourself as Eeyore? And I challenge you, for those who continue or sometimes, and I do this as well, I'll admit it, I am in the Eeyore moment at times. That moment of, it's never going right. Oh, well, I'm always in a rut. This is never going to get better. And you can hear all those conversations that are those Eeyore moments. Or is your perception of where we're going that what an amazing journey this could be for us to show the staff that we're working with, the community that we're in, the work that we can truly do to share in the joy of the new story that we're writing. Because remember, back in March, the story was over and we're writing a new book. And so can you move yourself into your unicorn experience? Brene Brown's one of my faves. At the moment, I go through phases, but you know, she says recently that we cannot numb our feelings, because when we numb the painful ones, then we push all of them aside. So it's so important for you to recognize that this is painful, to recognize and validate that there is grief and loss. I tell you, my son, who's the Aggie, he was a senior in high school last year. And in March, we realized that there might not be the senior prom. And my little fella is a dancer. He's the one that's body surfing across the group at every dance that they had. And I grieved as a mother that my son would not have that experience. It's okay to validate that emotion and that uncertainty, but then realize that he walked across the stage and got his diploma, and now he's moved on to the next chapter in his life. I do want to recommend, and I'll send these to you, or you can take a picture of the screenshot. For those who are yoga people, or those who may not be, Yoga for Beginners is a great way to just take some reflective time where you are and in your space. But then these are also some other apps that you can put on your phone and do a check-in for yourself, or recommend. I've recommended this for some of our administrative staff to do check-ins for the day in order that they may just ensure that they're right on the right path. So look for opportunities for you and your staff to do some things like that. We also have on our website free mental health screenings where you can go in and you can, it may or may not go, but we'll see. You can go into our website and look at, are you able to see that one? Maybe not. Anyway, when you go to the website, you're able to go to take a free mental health screening. They're anonymous. So if you have someone in your organization who may need to just do a little self-check, or maybe periodically, I'll have our staff do a self-check just to check in on themselves to see, do I need to maybe take some moments of mindfulness? Maybe I need to take a half a day to just do some reflection or catch up and things like that. So it's just real important for you to do some of those things for your staff as well. And then I just would like to wrap with just the fact that this is an opportunity for us as a community and as leaders to allow that childlike moment to come through. I have two young small nieces who started back to school yesterday, and of course they had their masks and they were ready to go. And I called yesterday afternoon and I said, how was your first day? And the third grader said, it was the most amazing day I've had in a long time, because she hadn't been in school since March and all her friends were there. So I asked the sixth grader, I said, so how was it wearing that mask all day? And she goes, you know, Aunt Robin, I think it's just the big people who have a problem with it. And so I thought, wrapping up with the moment of, if we as adults could step back and realize that sometimes if we saw things through the lens of a child, of every moment is just a new adventure and a new story to tell, that maybe we could experience each new day as it is. So I've put my contact information on there for you, and it can be shared as you may need, or you can call Samaritan at any time. I love to encourage people to really look past sometimes what we experience all around us, and really come back to that immediate joyful time that we can have with those around us in the moment. So thank you for inviting me to come and share and be with you today.
Thank you so much, Robin. We have time for questions. Did anybody have a question
Yes.
for Robin?
I have a question. Sorry. How many people, it seems like y'all are overwhelmed with people needing counseling and stuff. How many people are y'all able to accommodate or counsel, or is there a waiting list? How does that process all work?
Sure. So right now, we also have a partnership with Lamar University in their Masters of Clinical Mental Health program. So we host at least 3 to 5 interns each year. And so we were just able to add 3 new interns to our staff. And so we're able to support the need as we right now. So we, if you would ask to fill most of the clients within a 5-day period. We just have a real belief that that God will send us the right people at the right time. And each day my anxiety gets, and I start going to that Grand Canyon moment, somebody will give a call and say, hey, I need an internship. And I'd say, I'd love to have you.
Wonderful. Thank you.
This is Regina. I just wanted to commend Robin on an extraordinary presentation. I've been in this field for about 50 years, and it's one of the best I've ever heard. Robin, you did a beautiful job. We're so proud of the extraordinary work that you're doing in Southeast Texas. It's changing lives.
Thank you.
Do we have any other questions? I want to say, Robin, I just thought your whole presentation was so calming. You covered so many areas that a friend or family member or somebody I know has dealt with through this whole situation. And so it just made you know that it's real and it's okay to feel some of those, some of those things that are coming our way. Also want to take you up on your challenge to make that middle moment between the stimulus and the response an opportunity to give grace. This is a new story and it's what we make it. And we do have that ability to think about how we're going to deal with the situation. And grace is such a great way to fill that gap. And also, when we do get back to the internet, even if it looks a little bit different, you are more than welcome to roam in Rotary. You can sit at any table you want.
I would absolutely love that. My younger sister is Renee Latchley, who is with the Spindletop Rotary. So I've spent some time with them as well. So I'm definitely a party hopper for sure.
Oh, good, good. All right. Well, we will make a donation in your name to Rotary International Foundation, and we cover 7 different areas, and yours fit into so many different ones. I circled peace, I circled prevention and treatment of disease, child health, but education. I mean, there's just so many areas that you cover today that Rotary International helps out with. So thank you so much for being a part of us, and your presentation was fabulous.
Thank you.
Our next speaker is going to be Chelsea Tipton. Most of you know Chelsea. He's the music director for the Symphony of Southeast Texas. So you know he always makes it fun, so don't miss it. Also, get your donations in for the Lake Charles Club that we're going to, or area that we're going to take over there to their club later this week or early next week. And the flag project is on Friday, so we will see Pat and Gary as we pick up our flags either Thursday evening or early Friday morning. In closing, I want to thank you all for attending the meeting today. And we're going to end by saying the 4-way test of the things we think, say, or do. First, is it the truth? Second, is it fair
to all concerned?
Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned? Let me also say once again, my porch is open and available. If you want to do some social distance visiting, we can space my chairs out and just have a little time to chit chat about Rotary or whatever we might want to talk about. And go out and find opportunities to lead and to serve. Thank you all for joining us today.
Thank y'all. Have a great day.
Thank you, Mandy.